Well, good morning, and thank you for joining our Configuring NextGen Care Guidelines webinar. My name is Shauna Wilburn, and I'm one of the trainers here at eMedApps. If you haven't joined any of our webinars in the past, eMedApps is a healthcare IT services company, and we provide all services related to NextGen. This webinar today is all about NextGen and care guidelines. We'd love to help you with your care guidelines, with your upgrades. We do hosting, pretty much anything from needing an additional set of hands or someone to help facilitate your upgrade, or whatever you might need related to NextGen, we can help. So if there's ever a need in your organization, please don't hesitate to reach out to you. We'd love to help explore those opportunities and see how we may be able to help you out. But for today, we're going to focus mainly on care guidelines. Forgive me for starting so timely. I just have a lot of content to cover today, and I want to make sure that we have plenty of opportunity for questions and discussion and things like that. Now, obviously, with around 50 people on the webinar today, all the lines are muted just because of background noise, and you know how that goes with webinars. So forgive us for that. But if you have any questions, don't hesitate to put those into the questions window. We have eMedApps folks that are staffing that, and we'll either send you the answer or jump in and ask that question for you. You're also welcome to just send in a question that says, "Can you please unmute me?" And we'd be happy to unmute your line and allow you to ask those questions and have that discussion together. So don't hesitate to go that route either. I love the interaction. If you've ever been on any of the trainings that I've done, I love to have the discussion and talk through your unique situations, because in most cases, if you have the question or the situation, someone else does too. So please let us know how we can help and make sure at the end of our time together, you have a good understanding of care guidelines and what they can do for you. Just as a quick reminder as well, at the end of the session today, you will be sent a recording of today's session as well as a note sheet that I've put together. You may want to take some notes throughout today's session, but I will tell you the note sheet has all of the template names, a high-level review of what each template does for you, as well as some tips and tricks in there. So know that that's coming after the session and should come to you pretty timely. So we'll go ahead and dive in today and get started. When we talk about care guidelines, there's basically 4 topics that we're really going to talk about and dive in today regarding configuring care guidelines. And those are configuring care guidelines based on a test code, based on a description, based on a Cpt code, and then the couple of automated functions that NextGen sends your way. Now, when we talk about these items, we're talking about automation. We want the care guidelines to work for you. Care guidelines are great, but we want to take advantage of the automation that they offer and allow the system to work for you as a whole. There are certain care guidelines that just can't be automated, and we'll talk a little bit about that today, that the providers may need to update manually. But as a whole, lots of things can be connected into your documentation in these 4 different categories and really provide your group some nice automation. So we'll dive into the details of each of those today. So as we get started, I just want to make sure that we have some basic terminology outlined that as we go through the session today, we'll kind of be on the same page. So one of the things that we often talk about when it's related to care guidelines is orderables. Orderables are the items that have a checkbox here. They're typically something that's going to have a CPT billing code, a compendium code. These are also what we used to call protocols, would be your orderables. But we also have recommended care, which is a little different than your orderables. Recommended care are the items that you see here that do not have a checkbox next to them. And these items are more like advice or recommendation, things along those lines. And then as a general sense, you may hear me refer to just guidelines. This is really a generic term that we use to apply to any of these items, whether it be an orderable or recommended care. It's really just the line items that are contained within the care guidelines themselves. So each of these line items would kind of be a guideline, if you would. So to start our session off today, the most common question that I typically get related to care guidelines is, if there's a lipid panel, for example, in diabetes, and there's a lipid panel in health maintenance, how does NextGen choose, which one it shows? Because it's not going to show you a lipid panel in every different guideline that's applied to the patient's chart. It's only going to show you the one. And so how does NextGen make that choice? So NextGen makes that choice based on the lowest start age, the highest stop age, and the lowest time interval. So it takes those items into consideration and just shows you the one item that essentially is kind of due next, so that you will have the opportunity just to have that item listed one time and not be in the chart multiple times, even though you may have it configured multiple times. So just a little tidbit on that one, because that's kind of a generic item, but it is a question that we get a lot, so wanted to make sure that we spoke to that just a little bit in today's session. So to dive into the first item that we want to talk about today, and that is care guidelines based on a test code. So when we talk about each of these 4 scenarios, I'm going to give you kind of some practical examples of how they apply. Please know this is not all encompassing, okay? There are other scenarios, other situations. I'm just kind of giving you the most common items today for illustration, and we'll actually walk through some of the configuration and show you those items. So please just keep that in mind. You know, obviously you can go on the NextGen website, get tons of documentation that lines out everything A to Z. For today's session, I'm kind of going with just the most practical items, what we've seen the most questions on, so that it really kind of illustrates the point and you can kind of quickly make the connection on, you know, how that configuration may work. So speaking of that, when we talk about test codes, you know, if I say test code in NextGen, my mind typically goes to lab diagnostic orders. You think about test codes, you think about Quest, LabCorp, you think about NG codes. All of those things come to mind when you use the term test code. So that's definitely practical examples for how to satisfy a care guideline based on a test code. But the first thing I need to know, if I'm going to satisfy a care guideline or even work on a care guideline related to a test code, the very first thing that I need to know and be aware of is what that test code is. So let's stick with the example we've been talking about, the lipid panel. When I order that lipid panel down in my orders module, or if I order it through a template and flow it over to the orders module, it's going to show here in order management. I can highlight that test in order management and say edit. It's going to pop me up this order management window, and the code is going to be listed here. Now, the NextGen best practice is to link, you know, your labs to an NG test code. So that's what I have here in my sandbox environment. I have NG 303756. But in your practice, you may be using the NG codes if you have multiple labs. But if you only have one lab, you may be using that specific lab test code, and that's perfectly fine. Kind of the key takeaway here is when I highlight that in order management and say edit, the system's going to give me the code that's been ordered so that I can now tie that to my care guidelines to auto-satisfy. So I'm going to use the NG code because that's how my system is built and that's how I have my setup configured. But just keep in mind, yours may be a specific test code, and that's perfectly fine as well. But coming to order management will give you that code either way. So now that I have my specific test code, you know, I might take a screen print of this or jot that number down, because that number is going to be key to satisfying my care guideline. Because when I want to satisfy a care guideline based on a test code, I have to have 2 components to link those together. My order has to have that test code, and my care guidelines configuration has to have that test code so that they match up and link, and they can automatically update the care guidelines on the patient chart. So now that I have my NG test code, I can now go into my care guidelines configuration and see how the setup has been done to this point. So File, System Practice Template, and I'm going to open the configuration home. Now, those of you, I saw a lot of familiar names on the webinar, so great to have a lot of familiar friends that we've worked with in the past on the call. So those of you that know me know I'm kind of an old dog on NextGen. I've been around and worked on NextGen for many years. So I still call the configuration home template the new configuration home. So if I accidentally say that, just forgive me, because it's still new in my mind, because even though it came out a couple of years ago, it's still new to me. So, but I will use this all throughout the presentation today because I love it. It puts so many templates right at your fingertips, and it's so convenient to go template to template. However, please know, if you're one of the folks that likes to go into each template individually, you can certainly do that. There's no right or wrong about how you get to this template and open it up. It's just a matter of coming here so that now we can update the information. So since we just opened the care guidelines setup template, I'm going to take just a moment and talk a little bit about this template. I'm not going to do training top to bottom on this template, but I do want to point out a few of kind of the tips and tricks that we've learned and experienced over the years. So the first field that I want to talk about is this auto update. This is one of the best fields that is in this template because it's going to ensure that your charts are always synced up to what you have configured in the care guidelines configuration. If you're following along on your monitor and you pull up this care guidelines setup template and you don't have this field, that means that you're on care guidelines 1.0. Update soon. Go to care guidelines 2.0 because this one, there's a couple of other great features, but this one checkbox is worth the update itself, because what this does is this will, when you create a new encounter, it will automatically update what's on the patient's chart to match your configuration. So you kind of remove that issue that we've had in years past of people, clinical people in particular, MAs, providers, opening care guidelines and then reporting that they're not right or it's not working because they're not synced up with what they've seen on other charts. And that's because we didn't have this auto update feature. In years past, you'd have to reapply those care guidelines in order for it to take the updates, but you don't have to do that anymore on care guidelines 2.0. So check that out. And also, if you've been on NextGen a while, I think some of us that have used NextGen for a long time tend to overlook these little information buttons. This one is a great one and really lines out what this button does. So don't overlook those on this template as well, because it's a really good tool to kind of explain what this option does. And then I also wanted to mention just a little bit about the auto apply option here. Auto apply automatically will apply these care guidelines to your patient's charts. Now, some groups are a little nervous about that. They don't want things happening in their system, you know, that they're not controlling, and I definitely understand that. But two things that you should set up to auto apply, if not set up, go back to your clinic and set it up today, is health maintenance and peds. There's no reason not to apply health maintenance and peds because those are items that need to be applied to every patient chart, regardless of disease, situation. They're just based on age and gender, and they need to be applied to everyone. So at a minimum, turn on your health maintenance and your peds, let those be auto applying, save your team some work, while maybe you work through the details of some of the disease-based ones like diabetes or hypertension or hyperlipidemia and work on auto applying those. This auto apply is a great way to take advantage of NextGen automation and allow the NextGen system to work for you. It really takes a lot of the manual work away from care guidelines, and it allows you to really control who they get applied to based on the diagnosis groups that we set up and configure. So I'm a big advocate of the auto apply. It takes that step away from your staff, lets the system work for you. And then if you have auto apply and auto update turned on, when they open those charts, they're going to be rock solid. They're always going to match your configuration. And then the last thing I want to say about this template is if you are not using care guidelines today and you're taking this webinar because you wanted to kind of see and check out some of the options that it has, is here in the Orderable Test setup, NextGen starts you out with a great starter set of care guidelines. This is what it'll look like. These are right out of the box from NextGen. But what you want to do is sit down with your CMO or your clinical team and go through and evaluate these and clean this list up. You may not want all these care guidelines. You might not want all these diseases. You may not need everything that is in every care guideline, or you might want it to be a different interval or start at a different age, because NextGen's done their best to provide you this starter set, but based on your county, state, local governments, you may need something just slightly different. And that's the beauty of care guidelines. It really allows you to tailor this specifically to your practice. I'm going to show you in the presentation today how to add more items into this list. So really take this list, break it down, and make it your own, so that when your providers start to use care guidelines, it's really going to be exactly what they need. The worst thing that can happen is we roll out a new feature, provider opens it up and says, this is not even what I need. I really don't want to use this. If we do that setup on the front end and roll this out, the providers are going to really adopt it, and you're going to have a higher success rate because they're going to open it up, and it's going to be things that are meaningful to them. It's going to make sense according to the regulations that they know, and then it's going to be a much successful adoption phase because it's going to make sense. So when we look at the Orderable Test setup, we're looking at our Lipid Panel. We want to talk about how to set up care guidelines to auto-satisfy based on the test code. So the first thing that I'm going to do is click on the test name. This is a really nice grid here because it's sortable based on the headers. So I clicked on the test name, put my test in alphabetical order, and I'm just going to scroll down to the L's. And I'm going to pull up I'm going to show my lipid panel here for diabetes. So this is the configuration that I have, the lipid panel that I was seeing on the chart a moment ago. Now, when you look at the top, this is the way that the lipid panel is configured. So if you wanted to change this to start at age 16, you could just click in the start age and make that change and click update. Or if you wanted to change any of the other settings, you certainly could. The one thing that I want to point out here is the NG code. This is oftentimes confused with what we looked at earlier as far as satisfying the care guideline. Please know that this panel is all about the care guideline being on the patient's chart as well as ordering the care guideline. So this is the test because a lipid panel is an orderable. You could check mark it and order it right from care guidelines. So this is the test code that is actually going to order in your system if a provider or a clinical team member check marks it and places the order from care guidelines. That's what this code is. When we talk about auto-satisfying, that's going to be the codes down here in the next panel, the test equivalents and alternatives. So I highlight the row at the top, and now I can add in what I want to auto-satisfy my care guidelines. So the test equivalent and alternatives is what's going to satisfy or complete those care guidelines within the patient's chart. So when we talk about test equivalents and test alternatives, you have two different ways to put in the same thing. You've got your descriptions and you've got your test code. So to kind of break this down for you, the test equivalence is the test. That means that this is what is happening. In the case of a mammogram, this might be like the mammogram. It might be a mammogram screening, might be the actual mammogram test, but that is the actual test, the actual item that you're documenting. Guideline is something different that you want to satisfy that test. So in the example of the mammogram, you might have mammogram codes and descriptions listed over here, mammogram screening. Over here in alternatives, you might have something like a breast ultrasound. It's a different test, but you still want it to satisfy that mammogram care guideline. That's where your alternative tests come into play over here on the right-hand side. I'll give you another example to help illustrate this. FOBT. FOBT is a lab test. So we might have FOBT description and test code over here. That'd be another NG code for you, maybe. On the right, you might have colonoscopy, maybe sigmoid, just depending on your criteria. Those are different than the FOBT, but they're more detailed, like a higher level test. So if you have a colonoscopy, you don't need to turn around and get an FOBT done the next month. You want that colonoscopy to satisfy the FOBT. So again, that's where your alternatives come into place. It's a different test, but you want it to actually satisfy it because even though it's different, it's maybe better, or you still want it to count for that test to be done. So that's kind of how those kind of break down. In the case of the lipid panel, the example that we're looking at now, that's just the test equivalent because what we looked up in order management is the actual lipid panel test. So what I would do is make sure that my NG 303756 is listed right here. If I wanted to add in a different NG code, let's say it was a different one and I needed to add it in, I could just add in the code and now I would see it down here. It's just type it in, click add update. It's not very hard at all and it will list those here, as well as if I needed to add any descriptions, I could do that as well. I'm going to take this one out because I just made that up. But the key thing is the NG 303756, the test code that we saw in order management is listed here. So anytime that lipid panel is ordered or is completed, the care guidelines are going to update. So if I go into the care guidelines here on Danny Ocean's chart and I look at the lipid panel, I'm going to see that it was ordered on 5/28. If I go into the order module, I can confirm that that's correct by looking at the lipid panel that was ordered on 5/28. Now it's still at an order status because that has been ordered and we've not yet received the results. So care guidelines is essentially reflecting what we have in the order module, and it knows to do that because we have this test linked to the lipid panel care guidelines based on that NG code. So they have a common linkage, and the care guidelines can know what's been done in the order module. Now, labs will, as a rule of thumb, they come out of the box only updating to completed with a completed or results received. Will satisfy your care guidelines. If they're canceled or deleted, the care guidelines will update as well. So if I cancel this, and I'm just going to say testing, and I'm going to cancel the order. Now my status is canceled. If I open up the care guidelines, I'm going to see now that the lipid panel was ordered on 12/11 most recently. I did have 5/28 there, but that was when the order was at ordered status. When I canceled that order, the care guidelines immediately updated for me and now reflect the prior date of 12/11/2018 as to when it was ordered. So the nice thing about care guidelines is they are real time based on what's been documented in the chart and how the configuration has been set up to work for you. So that is the first scenario of configuring care guidelines based on a test code. So let's dive into scenario number 2, configuring care guidelines based on a description. This is going to be very similar because we're still going to go to the care guidelines setup, but instead of putting the information into the NG code, we're going to put the information into the description, which could again be an equivalent or an alternative. Either way, you've got the description field available. So scenario number 2, automatically updating care guidelines based on a description. So probably my favorite example to illustrate this is screening tools. Screening tools is where all your screenings have been documented in NextGen. And you can see as different things are documented and different assessments are performed for the patient, it all writes down to this bottom section here. So let's say for my organization, I need to perform a drug abuse screening test on every patient every year, annually. I have it documented here in the chart, which is fantastic because I've done the work. But if I look at my care guidelines, that's a pretty specific item. And if I kind of page through here, I'm not going to see that item listed because, you know, that's a little specific and that didn't come NextGen out of the box. But I can easily add that so that my care guidelines reflect exactly what I need to do within my organization. So I'm going to go back to my care guidelines setup. And this time, I'm going to start with my orderable test because I want to add this one in. So the first thing I'm going to do is just clear out the information that I have here. And for the condition, I'm going to say health maintenance because I want this drug abuse screening to be performed on every patient once a year. The guideline test type is very critical when you're trying to configure a care guideline based on a description. I'm going to use health screening, and it's going to be the MPROT test type here. That's very important to match up, and the guideline or test name is very important as well. So I'm actually going to just leave this open, and I'm going to sneak back into my screening tools and get that exact description that was performed for the patient. Now, used to, you can click up here and copy and paste it, but now I can't do that anymore. So I'm just going to take a quick little screen print so I can get the exact spelling that I need for my care guidelines setup. So when I come into my care guidelines setup, I've got to type it exactly as it appears in the chart, because when you're matching something up based on a description, it has to be identical. Codes are so much easier, in my opinion, to work with because it's a number, it's very straightforward, you get it right, it's going to match. When you start talking about descriptions, it gets a little bit trickier. Spaces, parentheses, things like that, it all counts. So we want to put it in here exactly as it appears on the chart. So I'm going to type in drug abuse screening test. And I'm going to call that my DAS. Now with NextGen, I don't know if that's my DAS, you know, that's the screening tool DAS that I have in the template. Okay, so now that I've got that typed in there, there's no test code because we're doing this based on description. I've got my interval at 1 year, 18 years. That looks pretty good. So I'm going to go ahead and click add to add that into the system. So when I do that, when I click add, that's going to add it into my care guidelines. And then what I can do is I can actually go back to the chart and look at this information and see it within the chart. So the first thing I'm going to do is scroll down through here. And I'm going to see, yes, my line item was added, my guideline item was added into health maintenance. And now I'm just going to go back to Danny's Ocean's chart, and I'm actually going to reapply that health maintenance care guideline. The only reason I'm having to reapply it is because I'm doing a live demo and I want to see it right now. Otherwise, when you do something like this on their next visit, it would automatically get added for you, so you wouldn't even have to do this. But because I want to illustrate it to you today, I'm going to kind of go ahead and reapply that. And now if I go out, I can see that my drug abuse screening test was added, and it was completed on 8/20. That's not today's date. That was in the past. But because the verbiage, the description was matched up exactly, it automatically let me complete that on the patient's chart. So that's an example of how you can update care guidelines based on a description. Again, just, the take-home message there is when you do the configuration, if I look down into my satisfy portion down here, that verbiage has to be listed exactly as it reads on the chart in order for that to match up. So that's scenario number 2. Scenario number 3 is configure care guidelines based on the Cpt code. So in order to illustrate this one to you, I'm actually going to switch charts and look at a kiddo, because this is a good example of where it comes into play with especially children pediatrics. So if I look at Bam Bam's chart here, if I go into care guidelines and take a peek at his chart, I'm going to see this fluoride varnish application is due. This is I get this exact scenario. I bet in the last 6 months, I've had 5 or 6 different clinics call and say, if I look and in care guidelines, the fluoride varnish shows due, but if you look at the chart, it was performed in the past. Why do my care guidelines still show it's due? This is a tricky one because we're expecting the care guidelines to update based on a Cpt code. We've already talked about updating care guidelines based on an NG code, but updating based on a Cpt code is a little bit different. We have to do a little bit of a different setup here, and it does not come configured out of the box. And I believe that's because NextGen doesn't configure this out of the box because different people, different regions, different codes, different payers, Cpt codes, there's so many variables. So what we have to do is we have to tell NextGen that for fluoride varnish, we want 99188 to satisfy that care guideline automatically for our providers. And we've got to set that up so that we can make sure that that auto updates for all the pediatric providers. So in order to do that, the first thing we need to do is get the Cpt code. So we grab the 99188 from the patient's chart. The easiest way to look at it is just see what's been charged out and billed in the past. So we've got the Cpt code. So now we have to go into the system practice templates again. Now I'm going to my configuration home, but this time I'm not going to go to care guidelines setup. When we talk about auto-satisfying, the main 2 auto-satisfying items that you configure on care guidelines setup is test code and description, the first 2 that we went over. For this one, I'm actually going to go into my datasets template. So if I go into my datasets template, I can see there is no Cpt code configured for care guidelines. So the first thing I need to make sure is that I'm on care guidelines procedure module codes. There's a lot of different data sets that you can configure on this template. We want to be in the care guidelines. There's 2 care guidelines, so don't let that trip you up. Care guidelines procedure module codes is the one that you want to be in. That's what's going to allow your care guidelines to auto-satisfy based on a Cpt code. Okay. The other thing is we have to make sure that the description, again, sorry to be a broken record on this, but we have to make sure the description is exact. So what I'm going to do is I'm going to hop back into my care guidelines and I'm going to sneak in a quick copy and paste. So I'm going to scroll down to my fluoride varnish and I'm going to copy this up here. Now, if you're not familiar with keyboard shortcuts, this is a great place to take advantage of those. Highlight the item you want, and a Control-C on your keyboard, Control-C is in copy on your keyboard will copy that. And then I'm going to go back to my datasets template and then click Add, because I want to add this one to the list. Now, it's not already there, so I have to create it. So a Control-V as in Victor on your keyboard will allow you to paste that. And then I just type in my code, 99188, and click Save. And now you'll see that that one's been added to the list. So what happens is, because you're putting this on a different template, you have to have 2 connections. Whereas when I put it right on the care guidelines template, I only had to have 1 connection right to the order. But because I'm putting this on the dataset template, I have to have 2 connections. The description connects me to my care guidelines. The code connects me to my chart. When those 2 pieces are linked together, care guidelines will know to satisfy it. So if this care guideline is due or on the patient, applied to the patient's chart, and if this procedure code is listed in the patient's chart, care guidelines will now pick that up and be able to satisfy that order. I want to save this. So now if I go into Bam's chart, I'm going to see the fluoride varnish was completed on 8/21 because I tied that separate CPT code to this care guidelines description, and now it's linked to the chart. And let me just double check 8/21/2019, and let's just double check when that procedure was done. So I'm going to go into my procedure module. I can pop that open and take a quick peek. 8/21. Everything is connecting up. So now with just one little piece of configuration that literally took you 30 seconds to add that code in, copy and paste the description and add that code in, never again will a provider have to manually update fluoride varnish. It will automatically do it for you on every single patient, every single time. The only reason it would not update is if they use a different code. And in that sense, if you needed to add another code, go back into data sets and add it in there. You can put more than one. If you have 2 or 3 fluoride varnish, I honestly don't know how the coding works, but if it's on age or the second one or the third one or however that works, if you needed more, you can certainly add more. There's no limit on those. And if any of them are present, it would automatically complete your care guideline and extend it out to, in this case, the 6-month interval. So that's scenario number 3, how to automatically update your care guidelines based on CPT codes. So we went over how to automatically update your care guidelines based on test codes, how to automatically update your care guidelines based on descriptions, how to automatically update your care guidelines based on CPT codes. And now the last scenario that we're going to go over as far as the auto updating piece is the one that comes out of the box from NextGen, which is documentation.
Sorry, Shauna, can I interrupt for a second? We have a question.
Absolutely.
Deborah is asking, if we are using the dental program, will it update to the EHR?
So Deborah, if your codes write to the procedure module, and I believe they will from EDR, they'll show right here. If your codes show right here, then you'll be able to use those. So just double check on one of your patients when you're back in the office. Just click on somebody that was maybe seen yesterday or today that's been charged out. Open up your procedure module and make sure you see those dental codes here. And if you see them here in the procedure module, you can link those up and let that care guideline auto satisfy. Absolutely. As long as they're written here, we can take advantage of those. Any other questions, Lynn?
That's it. Thank you, Shauna.
Okay, perfect. Thank you guys for those questions. Keep them coming. Okay, so the fourth and last auto update scenario, don't worry, we've got more to talk about, but the last auto update scenario is care guidelines based on documentation. And really there's no configuration for these. I just wanted to make sure I listed it because I think it's important to understand that NextGen comes out of the box with 2 scenarios that are pre-configured and they work based on stored procedures. So it's nothing you can really see in the application. It's just the magic under the hood that makes them work, for lack of a better term. So I'm going to pop open a quick PowerPoint and I'm going to show you how this works, and then I'll also demonstrate it to you. But this is the PowerPoint you're going to receive, so you'll get a copy of this image here. But you can kind of see there's green, there's purple, and there's maroon. So this is your diabetic foot exam. There are 2 scenarios in which NextGen comes out of the box pre-configured to update based on documentation in the system, and that is the diabetic foot exam and the PHQ-2. Those are the 2 scenarios. NextGen automatically works, okay? You don't have to do a thing. And the way the diabetic foot exam in particular works, because it has a little bit more logic to it than the PHQ does, is that these are different sections. There's 3 sections highlighted here in the color: the green section, the purple section, and the maroon section. And you have to have one field out of each section documented. So 1 green field, 1 purple field, and 1 maroon field documented, and NextGen will automatically satisfy that for you. I know it's kind of interesting, but I wanted to make sure everybody got a copy of this screen because this is key information to know. Like if I just document the foot structure normal and then the right and left normal here, that's not going to auto-satisfy my care guideline. I've got to make sure that I connect in at least one field out of each section. So to illustrate this for you, I've got Danny Ocean's chart open, and if I go to care guidelines, you're going to see the foot exam is due. It's due every year because he's a diabetic. I can see that here, and the foot exam is overdue. So I need to be sure and do that when I see the patient today. I have done no configuration on the care guidelines to allow this to work. They're completely out of the box from NextGen. And I'm going to go into the diabetic foot exam. Now, depending on your configuration, you may have the diabetic foot exam under the physical exam section right here on the left like I do. You might have it on the one-page exam. It's always going to be here. It's also in the skin and hair. There's a link. I mean, this link is all over in your PE section of your template. So you can kind of see how that's the same template that I have here. So we need to document one out of each section. So I'm going to say all normal, 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 and I'm going to say normal. So that's the green section, the purple section, and the maroon section. I want you to watch when I hit OK on this, and I'll say save and close, you're going to visibly see the care guideline number change right in front of your eyes for Danny Ocean. So rather than having, I think it was 9 items that were due, Danny Ocean is actually going to drop down right before us to, I believe, 8 items. Let me just give my system just a second to catch up. So this care guideline requires no configuration. There's no setup that has to be done. It comes out of the box working. You do have to be a little careful if you delete it out and re-add it back in. You need to re-add it back in exactly as you had it from NextGen, so everything will link back up. And NextGen has some great restore and clear items so that if you need to start over, they provide you some great tools in your system practice templates to be able to do that. But now if I come in, that foot exam was right here on the first page. If I keep going, I'm now going to see it right over here, and it shows that it was completed today because just with those documentation items, it automatically completed. So no configuration needed, nothing required on that, just comes out of the box working for you. So there's a couple of scenarios that NextGen ships where care guidelines will automatically update based on documentation, and just wanted to make sure that you were kind of aware of those because that can be a little tricky because if you look at configuration, you're not going to see really anything set up to make that work, but it's going to kind of mysteriously work for you, and that's where that comes from. Okay, so I'm going to switch back to Bam Bam. And I want to talk a little bit. So we've already talked about the 4 scenarios of how care guidelines can automatically update on the patient's chart. Test code, description, Cpt code, and then documentation are those kind of 4 scenarios. But there's a few other things that we get the opportunity to configure that are a little bit more tucked away. And I just want to make sure you guys know about these options because these can be really nice tools if we spend just a little bit of time to configure them. And one of my favorites is the metrics panel. It's so interesting because most of the time we open our care guidelines, this is all we see and this is all we work from. But just remember, this is a panel. If I close this panel, there are other goodies down here below that I can take advantage of. And one in particular are the metrics. If I open up the metrics and I come in here and I just say like pediatrics, I can see different things that are configured. So I can almost see kind of like a flow sheet type of information where I can see trending and see different information from visit to visit to kind of monitor the progress of the patient. NextGen again comes out of the box pre-configured with some of this, but you have some limited configuration options that you can do in this area as well. So I'm going to take Bam Bam for example, and I'm going to go into, this is one of those areas that unfortunately is not on my configuration home template. So I'm going to go over to my practice template and I'm going to go into the flow sheet setup. Flow sheet setup is going to allow me to configure or add to the existing configuration if that's the case. So for Bam Bam, we were looking at the pediatric configuration, and these are the things we were looking at and seeing. Some of these were blank because Bam Bam had never had that done, but some of the items like weight and different things were already trending for us. If I want to change this up, I can simply highlight a row and remove it if I want to, or I can add things to this. So if I come into this, if I click into the first field, I can choose from the different things that I want to add. So let's say I want to add vision screening because maybe that's something that I really, as a pediatrician, I really want to monitor. Maybe I'm passionate about that. You have a provider that you want, that really wants to trend this kind of information. These are all the options that you have to choose from. So that's why I said limited configuration. When we're talking about care guidelines back on the other main template, the sky's the limit. Set up whatever you need, whatever you want, whatever, you know, your providers desire. Set it up, make it work for them. But here we have some predefined choices. So let's say I want to do vision screening and I'm just going to document corrective lenses, for example. I get certain fields in certain areas to be able to add, and I'm going to click add, and now I have vision screening documented here. So I'm just going to close out of the template to configure that. And now if I go right back into Bam Bam's chart and I look at the peds, I'm going to see all my different visits where this patient was evaluated for corrective lenses and a yes or no based on what was documented that day. This day was documented and reviewed. This visit, it was not. Maybe this was a well visit and this was a sick visit. You know, you can make some assumptions about that, but the beauty of it is you can really tailor this to exactly what your practice would like to see. And everything I'm showing you today is configuration. This is not customization. This is nothing you have to put on a spreadsheet and keep up with for an upgrade. NextGen has provided us great system practice templates, and they're expanding with every update to where we have the opportunity to configure and tailor the system to our needs, and then that information upgrades with you. So you can see here, now I've added an additional couple of rows to this, and I could go back in and add more. It just depends on what my providers might need. So take advantage of this and really tailor this to your provider's needs. The more the system works for them, the happier they're going to be with all this information at their fingertips. Okay, one more toggle. I'm going to switch back over to Danny Ocean. Some of these examples are a little bit more practical for adults and some are a little bit more practical for kiddos. So please forgive me for the toggling, but I just want to give you real life examples so it kind of makes sense. So now another item that I wanted to show you is screening questions. Those of you that have been on care guidelines for a long time, back in the protocol days, you probably remember screening questions. But when the new care guidelines 1.0 and subsequent 2.0 came out, the screening questions are kind of, for lack of a better term, missing. They're not on this template. But the nice thing is the configuration and the logic for them are still here, and we can still get to them. We just have to go about it a slightly different way. So if I click on the grid view, it's going to take me to the old style protocols, and then I can come into my screening questions. So for diabetes, I can click on this and see the screening questions that I have configured for diabetes. These came out of the box with NextGen. I will caution you, these tend to show up in other areas of the system. Maybe, I'm going off the top of my head here, but maybe chronic conditions, maybe some other areas of the system, these show up. So I do caution you about editing these. But I mean, that's the same with any of your NextGen system practice templates. If you've been on the system for some time, you always want to be wise about your changes and make sure that they're, you know, changes that benefit everyone. But absolutely take advantage of it. I can change these up. I can take some of these out if the providers don't like the questions. You can see I've got a big, nice white space down here. I can definitely add some more if I wanted to. And you can really tailor these questions to what your providers would really like to see. So in order to do this, I'm going to go back into my handy dandy configuration home template. And this time I'm going to go into the DB pick list setup. And, you know, as it would happen to be, these are under screening questions. So kind of a nice linkage there. Sometimes things are not used, the same terminology is not used from table to table or template to template, but this one's a great one. It is. I click screening questions on the top. And I've got all the screening questions listed here at the bottom. To me, the initial view that you get is a little busy and messy. What I like to do is click on this qualifier 1, and it sorts it into the different care guideline items. So in taking our scenario of diabetes into example, you can see here, number 1, are you checking your blood sugar? Number 2, are you checking your feed each night? If I go back in and take a peek at those care guidelines, and go back into my screening questions, I can see Are you checking your blood sugar at home? Are you checking your feed each night? This is the exact questions that I'm seeing on the other template. Me, I always confirm that just to make sure I'm in the right place. A quick double check never hurts. I love to check it out and make sure. So if you want to modify one of these, you can just simply click down here, make your changes and say update, no problem at all. If you want to add one, it's a little tricky. You have to click add new list item. You would think you could just clear and type it in down here and click add, but there's not going to be an add button. It's a little tricky. You have to click add new list item and you pick screening questions. And then you'll see the add button show up at the bottom. So a little tricky there, but now you can get to it. The other little gotcha on this template is that the numbers, like the number 1, the number 2, the number 3, those are text. Those are not, normally you think when you see numbers that they're assigned by the system. Not true in this case. This is actually part of the text. So you look at diabetes and there's 8 questions. So if you do add new, I would start with 9 dot space and type in my question, because the numbers are actually, you know, I can show you, the numbers are actually a part of the list item, and that's simply the way that you update them on the chart for them to show in order. So screening questions is a great way to guide your clinical staff, make sure the right questions are asked for the provider, and make that information and those answers readily available to the provider to help speed up their visit and provide that information on the front end. Okay, and then the last item I wanted to show you how to configure is recommended care. So when I go into your care guidelines, we talked a little bit about this at the beginning. You've got your orderables with the checkbox. And then if I go to the next page, I've got recommended care items here. Recommended care items are a little tricky because in most cases, you cannot set them up to auto-satisfy. And that can be a point of frustration for the providers because in my experience, the providers want everything to automatically update from their documentation. They're not super crazy about coming in here and having to update these manually. If it's a few things here and there, usually you can get by with it. But if you have a bunch of things, you might have to reevaluate that. Totally your decision and how you want to set that up. But that's just been the feedback that I've received over the years. But one thing that you can do about recommended care, and I wanted to make sure everybody knew about this option, is you can link up medications to automatically update. This is a great feature. You see the aspirin here, and it shows not prescribed for Danny Ocean. So I've got the aspirin set up here. The way this works is when I configure my care guidelines, if I go back into my care guidelines setup, I can click the blue link up here at the top for recommended care. That's my little shortcut to recommended care. And if I scroll down to diabetes on the left, I'm going to see aspirin. The way this works is you've told the system that aspirin is a medication, and in the recommended care item, you've picked, you're not really saying aspirin the drug, you're saying aspirin the medication class. Just like you could say any of these other medication classes that I'm scrolling through, you could say beta blocker, blood pressure, you know, whatever recommended care you need, you could put information here so that it would document within the chart, and it will automatically update when a medication class drug is prescribed on the chart. So the way this ties in, this recommended care item is listed on the patient chart because you've told the system this is a medication, and any medication that's linked to the aspirin medication class will automatically update that care guideline. So how I get to that information is going into the medication classes and taking a peek at how those look. So if I go back to my care guidelines setup, I've got recommended care here, which we were just in, and we know it's the aspirin medication class. It's not aspirin the drug, it's aspirin the class. So now I can go into my medication classes, and if this template takes just a second to load because it is big, but if I click on aspirin, you're going to see all of my drugs that are in this medication class appear. So when you see aspirin on the patient's chart, or you see anti-inflammatory on the patient's chart, just know that that's not the med, that's the med class. Any of the medications that are prescribed in that class will automatically update the care guideline. So we can illustrate that here on Danny Ocean. So if I go into the med module, And when I open this up, what I'm going to do is I'm actually going to prescribe a 500 milligram aspirin tablet. So I'm going to say aspirin, and I'm just going to pick this 500 milligram tablet, and we'll just say bear, that's fine. And I'm going to select that. I'm going to do my prescription just like normal. Let's say I'm going to give them 10 of these, no refills, except, and now because this drug is a part of the medication class, when I go into care guidelines, I'm going to see that that is now prescribed. Whereas prior to me prescribing that, it was read and said not prescribed. And now because I prescribed it and all the linkages there in the tables and the configuration, it's going to not only say prescribed, it's going to tell me specifically what was prescribed. So the kind of the takeaway from this section of the presentation is the medications for recommended care can auto update, just depending on the way you've got them configured. There's a common misconception that recommended care just can't update, and it certainly can on the medication side of things. And then the last item I wanted to talk about today is a topic called Trace Amigos. And I'm just going to have to share this with you based on the PowerPoint that you're going to get a copy of. But this is a term that NextGen uses to refer to care guidelines of the 3 care guidelines of colonoscopy, FOBT, and sigmoid. So if you go on the NextGen Success community and you put in Trace Amigos, you're going to get documentation on this. It's so interesting that this is just the term that it's called. And essentially what it refers to is NextGen comes out of the box configured for these 3 guidelines to work together. So if you've ever had the scenario, I know personally I've ran into this, where you didn't feel like it was updating right and you went into the tables, into your configuration, and you're like, I took everything out. How is this still updating? It's because there's this embedded logic behind the scenes for these 3 particular tests, because they're clinically relevant. They're clinically related to each other. When one test is completed, it will actually update the other 2. It's kind of interesting. It's unique. I'm not aware of anything else that works like this, but it still goes by their individual durations or intervals, but it will automatically move these around and update these 3 tests in your care guidelines. So just please be aware of this. Again, it's a stored procedure. It's under the hood in NextGen. It's not really displayed in the configuration in any way. So just wanted to make sure you knew about that as we kind of wrap up the configuration session. So just a few final thoughts. I want to let you know that within NextGen, when we go to the configuration template, I want to show you this panel at the bottom called the FAQs. I don't know if anybody's ever noticed it or paid attention to it, but it is really great. If I open up, let's say I open up the diabetic foot exam, like when I click on some of these, see how the view document is grayed out? But when I click on the diabetic foot exam, the view document's highlighted blue. That's not the right one. Sometimes it pops up different ones, but let me try that again. Sometimes when you click the view document, it'll actually pop up the documentation for you. So I can't get it to work today. It's a little tricky out of NextGen itself. But when I click the view document, it pops up documentation additional documentation that will support that. So the FAQs are great. As you click on one on the top, the details in the bottom appear, and then some of them actually have supporting documentation linked right into the template. So it's very handy to look at different configuration items. A lot of your common questions are going to be here with a really great simple answer. So don't overlook the FAQs as you're troubleshooting issues or wanting to set up certain things. This can be a really great resource for you. As well as on the PowerPoint we're going to send out, I've included a couple of links to the NextGen Success community. These are really good documents. In the documents themselves, there are links to other documents. I know documentation can get a little overwhelming, but these are really great resources if you're stuck working on an issue or trying to resolve a problem. There's a lot of specific scenarios that are very much addressed here and gives you like just the simple answer on how to resolve it, not like a 5-page document. Sometimes it's like a grid of try this, and if not, try this, some scenarios like that. So It's really good. I've used this documentation a lot when troubleshooting, and I hope that it provides to be a good resource for you guys. So we've got 3 minutes left in the webinar in our time today. Lynn is going to unmute all of the lines. Does anybody have any questions or anything that I could try to answer for you on the session today? Anything about Care Guidelines configuration that you might want to ask?
Okay, Shauna, we've got a question in the chat box here. How do you configure PAP with Cpv 3 versus 5-year requirement?
Yeah, Cpv Three is that? Lynn, would you mind unmuting that user? Is that the one where you get the shot and then you have to get the second dose like a year later? You get the immunization, then you get the second dose a year later, and you have to be like over 65. Am I thinking of the right one?
Carla, you can, I've given you the ability to unmute yourself, but I can't actually unmute you. I think you have to do that yourself. If you're having trouble, maybe just type in the box there.
Sorry, it sounds like there may be a little bit of technical difficulty, but I'll tell you what I know about that one. I think I'm thinking of the right one. I'm not totally sure, but if I'm thinking of the right one, that's a tricky one because NextGen is always going to, if you set it up with one line item and you say you need it every 1 year, then it's going to show due in 1 year, and then it's going to show due again in a year, like for the third one, and that's not really clinically appropriate. The other option is to set up 2 lines, to set up Cpv 23 first dose and mark it as a once, and then set up Cpv 23 second dose, mark it as a once, and then you can, then your users, when they give the first one, they have to set the new date for the second one. I will be honest, there's not a great way to handle that because it's not an ongoing thing, and the second one is dependent on the first one. So it makes it a little tricky on the configuration side, but there are a couple of ways to get around it. I've seen clinics be successful with it. So those are the 2 ways I've seen people do it. It would probably boil down to just personal preference of which one you think would be best, or you may be using one of those today and just wondering if there was a better way. So hopefully that helps.
Okay, actually, Carla just came back in and said that she hung up instead of unmuting. So I hope she caught that there.
Okay, no worries.
But Carla, if you didn't catch it, then maybe we can follow up with you afterwards and get you that full answer. We do have one more question from Lisa. Do you know if there is a configuration to have the tabbed view available in Care Guidelines versus the old one?
Oh, you're talking about you're still on when you come to you're still on the out of the box protocols. You're not on the new Care Guidelines. Yours still looks like this right here.
Hi, Shauna. Yes. First of all, thank you for that presentation. It was actually wonderful. But yes, that's my question. We're currently in the out of the box Care Guidelines setup, and in our test environment, I believe it's been installed, the new version. If it's been installed, is there any other configuration that you're aware of that has to be done to map to the tab view versus the old view?
No. When you install the new one, it automatically goes to the paged view for you. So if you're logging in and you're still seeing this, I would venture to think maybe the install didn't get completed or there was some kind of problem with it. You might have to do that install again.
Okay, wonderful. Thank you very much. Again, thanks for this presentation. It was great.
Absolutely. Glad you enjoyed it. And then one more tip, I would just make sure that if you're going to the page view, make sure you go to 2.0, not 1.0. That can be a little tricky, but that auto update on 2.0 is really worth it.
Got it. Thanks.
Thank you. Anyone else? I know our time is up. If you need to leave, I totally understand, but I want to give plenty of time for questions. Anybody else have any other questions? Okay. Well, thank you all so much for joining. You can expect some follow-up with the documentation or a copy of the recording. And then if there's an opportunity, if you'd like to get some help with your care guidelines, it's been frustrating to you, you need an extra set of eyes to look at it, anything we can do to help, we'd love to be a resource for your organization. Please don't hesitate to reach out to info@eMedApps. Let us talk about what kind of solutions we could help with, and we'd love to have the opportunity to work with you. I hope everybody has a great day. Thank you so much for coming, and we'll chat again soon. Thanks, everyone.